My name's Brianna. I am going to be drawing some labs from a central line. So I looked at my sheet here and I'll be filling the blue before I fill the red. So I'm gonna hand my patient. Hi Ron, my name's Brianna. I'm gonna be your nurse today. I'm gonna sanitize my hands. We have an order to draw some labs from your central line today. Have you had that done before? He states yes. Have you had any complications with your line? He states no. Have you had any fluids running in recently? He says not today. If there were fluids running, we would put them on pause for at least 2 minutes. I will be using the proximal port, it's labeled on here, which is right here. And then you want to look in the chart to make sure that it is at least for French, the insert. So I wash my hands. I'm going to place some gloves on. Ron, can I have your name and date of birth? He says Ron Smith, 2/1955, which is what his name band says. So what I'll be doing is I will be putting a flush in, and then I will be pulling that back, and then I will be drawing another syringe, and then I will be flushing after that. Is that okay? And he states yes. Grab all my supplies here. So like I said, I'm going to be using the proximal parts here. So I'm just going to be cleaning here. I would unclamp, or it would be clamped right now. I would unclamp afterwards if necessary. I'm also going to check the site to make sure that there is no signs that it was removed or inflammation or anything like that. So I'm going to remove the air from my syringe. Okay. I'm going to apply. I would unclamp if needed. I'm going to push the syringe in. Any issues? Any pain? He states no. I will then draw back this syringe. I would clamp if need be. And this one would be discarded, so I'm going to set it off to the side. I then would clean again for 15 to 30 seconds. I'm going to attach my empty sterile syringe here, and I am going to draw back. I would clamp again. I'm going to attach that. I'm going to set that off to the side. I'm then going to, how are you feeling? He states okay. I'm going to clean again. I'm going to remove the air. I'm going to flush again. Still feeling okay? He states yes. I'm going to clean them for the final time. And if this was a pick, I would be pulsating for this final one. We'll get the air out. And flush this one in. Still doing okay? He states yes. I would then clamp if need be. I would apply the cap if there was a cap per facility protocol. I am then going to take my blood sample. I'm going to apply my my adapter device here. the blue was first, so then you would click this on here. It's going to fill up and it will stop when need be. I will undo that one. I'm going to do the red right away. Click that on, fill that up, and that will stop when it is full. I'm just gently going to rock them back and forth. I have labels here of the patient's name, date of birth, the date and the time the lab was taken. I will place that on here. I will place it on here so that you, that open view is still available so that lab can see if need be. I would then put this in a lab bag along with the order, send it down to lab. I would then document how patient tolerated, the date and time, and I would dispose of my extras, make sure the patient is in a safe position, bed is lowered, and he has his call late. If this was a peds patient, I would have some kind of distraction so that they are not scared. I would explain more on their level. I would dispose of my gloves and wash my hands, and I would make sure that my container goes into the sharps that I used, and also the one the blood I pulled back that is discarded, I would put that into the sharps container as well. Like I said, I would document, and that is all for my skill.